Okay, good afternoon, everyone. My name is Tina Higdon. I'm Medicare Coordinator for Payment Council on Aging, or PCOA, as you see here. This presentation is going to be recorded for placement on the PCOA website. My clock has 1 o'clock. I might be a little fast, I don't know. But anyway, we're going to move forward with this. Right here, you'll see the number for our SHIP helpline. And the email address if you have any questions. Remember, open enrollment does go through December 7th. And we are still taking phone calls and emails for counseling. I think I went just a bit into Eileen's section. So Eileen is going to be our first presenter. So Eileen, I'm going to mute myself and hand it over to you.
Great, thank you, Tina. Can everybody hear me okay? I'm going to assume that's all a yes. My name is Eileen Jackson. I'm one of the PCOA volunteers that works in the Medicare division, and I am here to talk with you about understanding Medicare. I am a volunteer with PCOA, and what I wanted to just reiterate at the top of the hour here is that we are not salespeople in any way. Our entire role is to provide information for you to help understand Medicare so that you can make decisions regarding your Medicare choices that are available to you. We're going to be presenting a lot of information, including explaining the basics, what kind of help is available for people out there with lower incomes, how you would go about enrolling, how you would make changes once you are enrolled, and some of the Medicare hot topics that are affecting Medicare participants in today's world. Again, it's going to be a lot of information. We'll go at a fairly swift clip. You will have questions afterwards, and we will be here to answer questions at the end of our presentation. But please know that you'll leave here and think of 20 questions that you should have asked while you were here. And that's what the Medicare helpline phone number is for, to help you field those questions. Our extremely dedicated and knowledgeable volunteers man those phones. They return phone calls religiously and will speak with you about your specific Medicare questions. So with that, I'll take next slide. We're going to start right in on Medicare basics. Who is eligible for Medicare? The two main ways people become eligible for Medicare are by aging in at age 65, or if you are a disabled person on Social Security disability income in that 25th month of receiving SSDI, you would automatically be enrolled in Medicare as well. So you can be a Medicare participant even if you are under the age 65, if you are on SSDI. You'll see on our chart that there are a couple of other ways that are medical condition related to qualifying for Medicare. If that happens, if any of these happen to affect someone who's listening, we can talk about that in the Q&A or later with a phone call between you and one of our volunteers at PCOA. Medicare is managed by the Centers for Medicare and Medicaid Services, or CMS. And you must be a US citizen or lawfully present in the United States to qualify for Medicare coverage. Next slide. This slide is Medicare Choices in one sheet of paper, in a nutshell. You're going to be making a decision to stay on original Medicare or enroll in a Medicare Advantage plan where you'll be receiving your Medicare benefits through private insurance companies. Original Medicare, your benefits and your claims are going to be managed by CMS that I just mentioned on the previous slide. Under Medicare Advantage, your Medicare benefits and claims would be managed by whichever private insurance company you choose to enroll with. You'll see two solid black lines down the middle of this slide. And when you look at this slide in the future, think of those as the same as the two solid lines going down a highway. Your car is not meant to pass over those lines. So if you're on original Medicare, you're dealing only with the left side of our slide. If you're on Medicare Advantage, you're dealing only with the issues that are shown on the right side of the slide. So for example, supplemental insurance, which you see on the original Medicare slide, does not go with Medicare Advantage that you see on the right side of the slide. You will not be crossing those two lines. Please see the purple language on the bottom of the left-hand side of the slide. Original Medicare beneficiaries may see any Medicare provider in the United States who is accepting patients. So let's start tearing into the difference between original Medicare and Medicare Advantage, starting with original Medicare, and the next slide, please. Original Medicare has been around since 1965. It is comprised of two parts: A, your hospital insurance, and B, your medical insurance. You're going to see that there's another couple of parts as we get further in the presentation, including supplemental insurance and Part D prescription drugs. But we're just going to concentrate right now on Part A and Part B. And again, you see that purple language. If you're in original Medicare, you are not limited in terms of the providers that you may see, like you might be under Medicare Advantage. Next slide, please. So what does Part A and Part B cover? Part A is hospital insurance. So when you think about Part A, think about the buildings, fees that are going to be paid to a hospital or any other kind of healthcare institution, a rehab or a skilled nursing facility. And here we're not talking about someone who's living in a skilled nursing facility simply because they can't live on their own anymore and are in a nursing home, so to speak. This is meant to cover short-term stays in a rehab or skilled nursing facility following a hospital stay when you're not quite ready to go home and you might need some physical therapy or some occupational therapy. Hospice, fees to hospice facilities are also covered under Part A. Part B is your medical insurance, and that covers all your doctor's services, your outpatient care, any medications that are administered by a doctor in a doctor's office, many preventive services, including shots and screenings, your diagnostic tests, labs, x-rays, CTs, MRIs, therapies, whether that's occupational, physical, or speech, your durable medical equipment, wheelchairs, walkers, any other, maybe a CPAP machine or other durable medical equipment and supplies that you need to manage some of your conditions, and emergency and urgent care, including ambulance service to a nearest hospital. Next slide, please. What do Part A and B not cover? Part A and B do not cover prescription drugs. We're going to talk about Part D a little bit later that does cover prescription drugs, but these first two original parts of Medicare do not cover drugs. Dental care and dentures are not covered. Hearing aids and eyeglasses not covered. What I want to say about dental care and eye care and hearing care, if you have an injury or an illness that is affecting your hearing or your eyes, you have an infection in your teeth, some medical conditions that are related to teeth, eyes, and ears are covered under medical insurance and Medicare. What we're talking about here are your 6 months dental care appointments for cleanings and checkups. Your annual checkup for your eyeglasses where you go and get a new script. Those kinds of things are not covered under Medicare. Cosmetic surgery is not covered. Much alternative care, including naturopaths, is not covered under Medicare. There is some limited coverage for acupuncture for lower back pain. Custodial and long-term care, we talked about this on the previous slide. The rehab and skilled nursing facilities for custodial and long-term care are not covered by Medicare. And then if you are traveling internationally, including on a cruise ship in international waters, you would not have your Medicare coverage available to you for those, for anything that might occur during that time frame. Next slide, please. So we know a little bit about what Part A covers. What does Part A cost you? So for most people, the premium for Part A is going to be $0. I do not say that the premium is free because you've been paying for Part A hospital insurance in every paycheck that has had Social Security or FICA taxes coming out of it. That is how Part A trust is funded. So if you have 40 credits of work, and a credit is roughly equivalent to a quarter of a year. So this is really equivalent to 10 years of service where you've been paying your Medicare and FICA and Social Security taxes. You're going to qualify for premium-free Part A. And incidentally, if you were a stay-at-home spouse and your spouse who was working qualifies for premium-free Part A, you will as well, even though you don't have that work requirement. You'll see in the smaller print under the premium zero, the monthly premiums for Part A for those people who do not have 40 plus credits to qualify them for the zero premium. They're fairly substantial numbers, but again, most people are going to qualify for that premium free. Then once you're in the hospital insurance program or Part A, and you get admitted to a hospital, you have a deductible per benefit period of $1,556. And these are new numbers for 2022. I believe this is the first presentation I've done where we've had the new numbers for 2022. A benefit period is different than a normal deductible. Most people are used to annual deductibles where you pay the first $500 or $1,000 worth of your medical expenses before your insurance kicks in. This is a benefit period, so we need to talk about what that means. A benefit period begins when you have not received inpatient services for 60 days in a row. So an example, I fall down and I break my leg and I actually have to be admitted to the hospital for a while. I'm in there for a couple of days, I get discharged. 3 weeks later, I get a really bad flu and I'm back in the emergency room and they decide to admit me. I have not been inpatient service free for 60 days in a row. So I'm still in the same benefit period that I was in for the broken leg, even though the flu has nothing to do with my leg. So I would not pay a new deductible for that second admission. If I'd waited 60 days to get the flu and be readmitted, then yes, I would be paying that hospital insurance deductible again because I'm in a new benefit period. Once you've paid the deductible, the first 60 days of your hospital stay, there's a zero copay due to the hospital. You see the copays for the next 2 periods of time, which are fairly high numbers and kind of scary. The only thing I can say about this is, when is the last time you've ever heard of someone being allowed to stay in a hospital for more than 60 days? Generally, by then you'll have been discharged home or discharged into a skilled nursing or rehab facility. But those numbers are there and they're out there if you happen to be unfortunate enough to have to be in a hospital for that length of time. Skilled nursing facilities or rehab facilities. Medicare will pay for these if you have been in the hospital for 3 consecutive midnights prior to the stay. If you don't have those 3 consecutive midnights for your stay, then Medicare is not going to pay for that related skilled nursing or rehab facility. But if you have the 3 consecutive midnights, you've got a copay of 0 for the first 20 days there. Then from 21 to 100 days, you pay $194.50 per day. And after 100 days, you pay all costs. Again, those are generally short-term stays in skilled nursing facilities. So hopefully people aren't getting into those co-payment days or paying all cost days. And then if you happen to be receiving hospice services, you would have limited costs for pain meds. If you choose to opt into some inpatient respite care, you would pay for up to about 5% of what those costs would be. But please note that hospice does not cover room and board. So if you're in a skilled nursing facility and you elect hospice care because you qualify for it, and you decide to receive that hospice care while you're in a skilled nursing facility, hospice benefit does not cover that room and board for your hospice stay. To give you an example, my mother was in a skilled nursing facility and she decided to elect hospice care, stop all physical therapy, and stop all treatment for what her underlying conditions were, she elected to go home to receive her hospice care. Had she elected to stay in the nursing facility, she would have been responsible for paying that daily rate. Looking at the bottom here, again, purple language, very important. Original Medicare does not have out-of-pocket limits. So we've talked about some fairly large out-of-pocket expenses here. There's no out-of-pocket limit under Original Medicare. You may be used to this with your insurance company now, where once you've paid out $5,000 of your own money, the insurance kicks in and it pays 100% of your claims. Original Medicare does not have an out-of-pocket limit, and those costs just add up. So in a fairly significant medical issue year, you could have some significant out-of-pocket costs unless we do something about that, which we'll talk about in the next couple of slides. Next slide, please. Part B costs for 2022. Generally, people are going to be paying $170.10 a month for their Part B insurance. And again, this is the new 2022 premium for this amount. Some people will pay a modified premium. By modified, I mean increased, if you are in a higher income bracket that's shown on this slide. 91,000 as an individual, 182,000 for a married couple. If your income from 2 years ago, so in this case, 2020, exceeds those limits, you would pay an increased premium. There's a slide a little bit later that's going to show what those increased premiums look like, so we can talk about those numbers. Please note they do it based on 2 years ago, your tax returns from 2 years ago, because that's the information that Medicare has. If your income has significantly reduced in the present compared to 2 years ago, there is an appeals process for this adjusted premium. When you get a letter saying that your premium is going to be adjusted upward because of your income, the instructions for appealing that decision should be in that letter. And that is one of the things that our volunteers at PCOA can help you out with as well. So in Part B medical insurance, you have an annual deductible of $233. And this is a true annual deductible versus the benefit period deductible under Part A. You generally are then going to pay 20% of your Medicare approved expenses. Medicare will pay the rest. Note, there is no charge for many preventive services, and the Medicare.gov website will provide a nice list of what those preventive services are. So does the Medicare and Me booklet that you may have received in the mail. Again, Original Medicare does not have out-of-pocket limits. You will pay 20% of all of your approved Medicare expenses without a limit on an annual basis. Next slide, please. Okay, this is the adjustment premiums for Part B and also Part D, which we haven't talked about. We can come back to that a little bit later, but you will see you can find your income level, whether you're individual or joint, and you see what the Part B premium would be for you at that particular income level. So this is a good slide to hang on to. Next slide, please. So we talked about some out-of-pocket expenses that can be pretty daunting when you look at the dollar amounts. So in 1980, the federal government recognized this problem and invited private insurance companies to participate in Medicare for the first time by offering supplemental insurance policies that are designed to work together with Original Medicare and help pay some, maybe all, of those out-of-pocket expenses. So now we're going to spend the next few slides talking about supplemental insurance, or what's more commonly known as Medigap. Next slide, please. Okay, there are different types of supplemental insurance. Medigap is what we're going to really concentrate on in this presentation, but understand that there are some retiree health benefits that also serve as supplementary to Medicare. So you need to know if you qualify for any of these. So obviously the military is a big one, TRICARE for Life or CHAMPA policies if you're eligible for those. Federal employee health benefits policies, if you had been a federal employee, act as a supplement to Social Security. And some large employers or unions have supplementary insurance plans that work hand in hand with Medicare. The point of this slide is not that we can talk to you about all of these different types of retiree health benefits, but it is for you to know that you need to find out what, if anything, you might be eligible for from a prior employer, maybe even an employer you worked for 10 years ago and moved on from. So that's for you to investigate whether there are supplementary policies available through those organizations. And then access or Medicaid for those people of sufficiently lower income. Medicaid acts as a supplementary policy to Medicare as well for people who qualify. But we're going to spend our next few slides talking about Medigap, which are private insurance policies specifically designed and approved by the federal government to work with your Medicare coverage. Next slide, please. Medigap policies pay all or some of your Part A or Part B costs. You have to be enrolled in both Part A and B Medicare in order to purchase original Medicare, in order to purchase a Medigap policy. And please make sure that the policy says Medicare Supplement Insurance. There are 8 different kinds of plans, and they are also denoted by letters A through N, with some letters missing in the middle because some plans have come and gone throughout the years. These plans are standardized by federal law. So if you're talking with 3 different insurance companies and you want to buy a Plan G, please note that the benefits are the same in each of the 3 insurance companies, even though they may have 3 different premiums. Some of the benefits some of the plans can offer additional benefits like a gym membership or discounts on eyeglasses or hearing aids or something like that. But the traditional insurance benefits that are offered by a Plan G is the same regardless of what company you buy it from. So I like to say a Plan A is a Plan A is a Plan A. A Plan G is a Plan G is a Plan G. So we're going to talk about what those different plans look like. Next slide, please. It's kind of a busy slide, but it's a good one. So you'll see along the left-hand side of the chart, all the different out-of-pocket expenses that we just talked about, Part A deductibles, Part B deductibles, co-insurance. You're going to see across the top, Plan A through Plan N. I'll talk about that shaded C and F here in a second. And then you see in the columns what that plan, we're going to look at Plan G because it's the plan with the richest benefits. You'll see that it pays 100% of the Part A deductible, 100% of the Part A co-insurance, 100% of skilled nursing facility co-insurance. It's going to pay for Part B co-insurance, Part B excess charges, which I'll explain, and give you 80% coverage for emergencies that happen while you're traveling in a foreign place. Part B deductible, you see it there circled in red. None of the plans that are currently available to new Medicare participants will cover that Part B deductible, but you will see Plan C and F on the right there. They do cover 100% of the Part B deductible. Several years ago, Congress got together and decided they wanted every Medicare participant to have some skin in the game. And so they didn't want to be able to, people to be able to purchase a supplementary plan that covered absolutely every out-of-pocket expense. And this is what they came up with, was that for those plan participants who became eligible for the first time after January 1, 2020, they can no longer buy a plan that will cover the Part B deductible. However, if you first became eligible for Medicare prior to January 1, 2020, you still have the option to purchase a C or an F plan that does cover 100% of the Part B deductible. So that all hinges on when you first became eligible for Medicare. Many people become eligible for Medicare and do not elect right away. They defer because they're still working. So if those people were eligible before January 1, 2020, they also have a choice to buy a Plan C or a Plan F. The other thing I want to show you on this chart, if you look across the top above the letters of the plans, you'll see dollar signs and dollar amounts. This is an average premium annual premium that you could expect to pay to a private insurance company for that letter plan. And remember, it's an average premium, so that premium doesn't exactly exist on the charts that are available at PCOA that will show you all the plans that are available in Pima County and what their premiums are, but it gives you an idea of the kind of out-of-pocket expense you'd pay each year for a premium to buy a supplementary policy to protect you from the out-of-pocket expenses under original Medicare. And the last thing I want to talk about on this chart is above the column labeled G, you see HD with a little footnote there. HD stands for high deductible. Plan G has some really rich benefits, but obviously it's one of the more expensive plans. And if you choose to buy a Plan G that has a high deductible, you see that average premium above the $1,300 number is now $474. That's your annual premium. But when you do it that way, you agree to pay $2,370 of a deductible before the supplementary plan kicks in and pays you anything. But it does have the effect of reducing your premium quite a bit if you're interested in a high deductible Plan G. There is also a high deductible version of Plan F for those people who are eligible to buy Plan F. So we're now going to talk about the Part B excess charges on the next slide. You'll see that Plan G covers 100% of excess charges. Most of the other plans do not. So what is an excess charge? This is a great time to talk about the different kinds of Medicare providers. There are three kinds of providers in our country. There are participating providers, and those are people who agree to accept Medicare and Medicare's assigned amount for any given service. Then you have what are called non-participating providers. This does not mean they don't participate in Medicare, but it does mean they have not agreed to accept Medicare's assigned amount for a specific charge. They can charge up to 15% more than the Medicare assigned amount, but they still take Medicare patients and still will bill Medicare for your services. Then there are opt-out providers who do not accept Medicare in any way. And if you happen to find yourself in an opt-out office, you would have no Medicare coverage whatsoever. The good news is between participating and non-participating providers, it's in the mid to high 90% of all of the different types of providers in our country do accept Medicare. Opt-outs are very few. A lot of times you'll see that those might be psychiatrists and psychologists who are doing analysis and that kind of care that might be opt-out providers. But you can see why it's important to know, is your provider a participating provider, a non-participating provider, and especially, are they an opt-out provider? So let's get back to excess charges. If you are in the doctor's office and they're a participating provider and you go in and you have a doctor's appointment, the Medicare assigned amount in this example is $100 for a doctor's charge. If you're with a participating provider, Medicare is going to pay 80% of that 100. If you have the Medigap plans that are listed below, the plan is going to pay that other 20% and you're going to pay $0. Let's say you were in a non-participating provider's office. Remember, they can charge up to 15% more. So they're going to charge you $115. Medicare is still going to pay only 80% of the Medicare approved or assigned amount. So they're still going to pay $80 with the balance of the bills now being $35 instead of $20. When you have the A, B, C, D, or M Medigap plan, they're only going to pay the $20 and you pay the excess charge of $15. But those plans F and G do pay for excess charges, and then your bill is still going to be $0. So that's what Part B excess charges means and how that applies to our Medigap plans. Next slide, please. Okay. If you've decided that you're thinking about original Medicare, you like the idea that you can see any doctor anywhere in the country, even if you live in Tucson and you want to go see a New York specialist. So I'm going to explore original Medicare. You probably want to also explore whether you want and can afford a Medigap plan at the same time. And if you're talking to different Medigap providers, this is a chart you can use to help you identify some questions. How long has the insurance company been in the market and what are they rated? What's their premium for the age that you are when you're going to be accepted into the plan? Does the premium include an enrollment discount? A lot of times plans will have, for want of a better term, a teaser rate. And that teaser rate might go away a little bit for the first 3 years. Every year, they lose the teaser rate. So you want to know how many big jumps you're going to have in your premium because the enrollment discount's going away. Does it have a household discount? Medigap plans are individual plans. So if you and your spouse are both eligible for Medicare, you both want a Medigap plan, you have to sign up for your own individual plan. Sometimes providers will provide a discount if you and your spouse buy from the same company. What's the premium history? So you get an idea of how much premiums might go up each year. Do they have crossover billing, which is really nice. You're in your doctor's office, they bill Medicare for you. And then if they have crossover billing, Medicare will automatically bill your Medigap policy. And then all you get is an explanation of benefits in the mail that says all your bills are paid. You don't have to file any claim with a Medigap provider. If you do not have guaranteed issue and you have a pre-existing condition, see if the plan will accept you and how long they would exempt that pre-existing condition. So Vicki's going to talk about guaranteed issue a lot more in the second half of our presentation, but it's so important, I will mention it here as well. The very first time you sign up for Part B medical insurance, it begins a 6-month guaranteed issue period for Medigap, meaning no insurance company can turn you down because you've got medical pre-existing conditions or because you're too old or because you smoke or what have you. They have to accept you. And they cannot charge you more than they charge the healthiest person in the room. So that's what guaranteed issue means. For 6 months following initial sign up for Part B. Even if you're in your guaranteed issue period, if you are coming from an uninsured state, in other words, you have no medical insurance, and this is the first time you're going to have medical insurance, they can exempt some pre-existing conditions for a period of time, and you'd want to know what that period of time is. Next slide, please. Okay, that's original Medicare. We haven't talked about Part D yet, and I remember that, and we'll get there. But right now we're going to shift gears across those double lines and talk about Medicare Advantage, which is a completely different way to get your Medicare benefits. Sometimes Medicare Advantage is referred to as Part C. Sometimes you'll hear Part A plus Part B equals C. Really, Medicare Advantage is the name for private insurance policies that are sold to Medicare participants, and they are a different way for you to get your Medicare benefits. So let's dive into Medicare Advantage now. Next slide, please. Many of the Medicare Advantage plans also include Part D prescription drug coverage, and that's going to be significant as we continue this conversation. And we will still give you more information about Part D as it pertains to original Medicare as we go along here. Medicare Advantage participants have all the same Medicare rights and protections as original Medicare participants. Many Medicare Advantage plans offer extras like vision or dental discounts or allowances toward that kind of care for you on an annual basis. If you go Medicare Advantage, you are choosing to receive Part A and Part B benefits through a private insurance company instead of through the federal government and CMS. If you're a Medicare Advantage member, you're going to use the private insurance company's plan ID card at your doctor's offices. You're going to put your original Medicare card away in a safe place at home. Never throw it away, but store it in a safe place at home and use only your Medicare Advantage card. If you're going to be on Medicare Advantage, you should not be or let anyone sell you a Medigap plan. Medigap plans do not work with Medicare Advantage. They are not needed with a Medicare Advantage plan, and that'll become evident as we go through our slides. Next slide, please. There's different types of Medicare Advantage plans, HMOs or health maintenance organizations. Generally, you're going to need to sign up for a primary care physician who's going to act as the gatekeeper for all of your medical care. You will need to use network providers to get your benefits. And if you're outside of the network, you're generally not going to have coverage, with the exception of emergencies being covered out of network. but any follow-up care that you may be getting for that emergency injury is not going to be covered unless you get yourself back to your home base and start seeing your network providers. Then there are PPOs, or preferred provider plans. And here you have the option to go outside of the network, but the amount of money that the insurance company is going to pay for out-of-network providers is going to be smaller than if you use the network providers, but it gives you that flexibility. You don't generally need a primary care physician. You can go directly to specialists without referrals under a PPO, so you have a lot more flexibility under a PPO than you do under an HMO. Then there's this kind of hybrid plan or funky plan called a Medicare Savings Account plan. And under MSA plans, you can see any Medicare participating provider. Please note it says participating provider. It also says that up in PPO. So not the non-participating providers, but the participating providers who are accepting new patients. The plan deposits, and there's two different MSA plans in Pima County right now, either $2,000 or $3,000 into a Medicare savings account for you. And they deposit that every calendar year. You then have to pay 100% of your Medicare approved amount, not 20%, but your Medicare approved amount, 100%, including the full cost of preventive services, until you have paid out $5,000 or an $8,000 deductible, depending on your plan. And then the plan kicks in for the rest of the year and pays 100% of your claims. So this can be kind of attractive to people who are hitting Medicare for the first time. They don't have any medical conditions. They're not really on, having any regular Medicare. They feel like they've got another, they've got a whole bunch of years ahead of them when they're not going to be using benefits, and they're going to keep getting this $2,000 or $3,000 deposited into their plan every year. That money carries over and accumulates in this account, and you can use that to defray your out-of-pocket medical costs while you're paying your deductibles. So next slide, please. Those are the three different kinds of plans that we're going to talk about. And it's also a good time to review participating versus non-participating providers. You'll note that even with a PPO, you have the option to go outside of your network for your benefits. But if that outside of network person is a non-participating provider, they don't have to see you if you're a Medicare Advantage member. They can say, we don't see Medicare Advantage members. Why do you care about this? My biggest example is the Mayo Clinic, of which we have one in Scottsdale. And a lot of people like to go to Mayo Clinic for a second opinion. Mayo Clinic is a non-participating provider. So if you wanted to go out of network and see Mayo Clinic, those bills are generally not going to be covered by Medicare because Mayo Clinic doesn't have to see Medicare Advantage members. So that's an important thing for you to remember. Next slide, please. What are the Part C costs, or what kind of costs can you expect to pay out if you're a Medicare Advantage person? This is really important. Everything starts with Part A and Part B. Everybody, even if you eventually end up on a Medicare Advantage plan, is going to have to sign up with the federal government for Part A and Part B. And so the premium for most people is going to be $0 for Part A unless you don't have your 40 credits in. And you're still going to pay the Part B premium to the federal government, that $170.10 per month. Then you need to look and see if there's a Part C plan premium that needs to be paid to the private insurer. You'll see that $0 is circled. The HMOs in Pima County, for the most part, are going to have a $0 premium. There are many PPOs that have a $0 premium, but you'll see that there are plans in Pima County that have premiums that range up to $119 a month, but there's lots to pick from that don't have a Part C plan premium in addition to the Part B premium. So then there's going to be a $0 deductible for most of the HMOs and some of the PPOs. Note, there may be a separate deductible for drugs that are covered by a Medicare Advantage plan. And then depending on which plan you sign up for, you can see all different kinds of ranges of co-payments or co-insurance. Primary care, You can have a zero copayment to go see your primary care physician all the way up to $35. Specialist 0 to 80. Ambulance service, you see the range there that you would either pay a copay or co-insurance anywhere from 20 to 40%. You see the hospital stay. Depending on the plan, you might pay $100 a day all the way up to $375 a day for the first 5 to 7 days. See how different that is than that one-time deductible you pay for hospital under original Medicare. So it does depend on which Medicare Advantage plan you choose to be able to talk about what your specific out-of-pocket expenses are going to be. But what I want to talk about here is the out-of-pocket limit. There are plans that have an out-of-pocket limit of $2,400, ranging all the way up to $11,300 per year. That out-of-pocket limit serves as a stopgap for how much you'll ever pay in any given year for out-of-pocket expenses. Once you've hit that $2,400 or $5,000 or whatever the plan is, the plan kicks in, pays 100% of covered benefits until the beginning of the next year, and everything starts over again. Please note that out-of-pocket limits exclude Part D costs or drug costs and extra benefit costs. They're not included when you're adding up to that out-of-pocket limit. Next slide, please. So now it's time to talk about Part D, prescription drug insurance. So for a long time, Medicare participants did not have prescription drug coverage all the way up until 2006. When the feds realized we need this kind of coverage. So again, they invited private insurance companies to offer drug coverage for both original Medicare and under Medicare Advantage. And if you recall, when I talked about it, Medicare Advantage, most Medicare Advantage plans, not all, so you have to be careful, but the vast majority of Medicare Advantage plans offered in Pima County roll their prescription drug coverage in with their Medicare Advantage plan. If you're going to be on original Medicare, you're going to need to pick up a separate Part D prescription drug insurance plan from a private insurance company. So let's dive into Part D for a little bit. Okay, you must first enroll in Part A or Part B to get a Part D plan. Each plan has a formulary, which is nothing more than the list of covered prescription drugs, and that varies by plan. And each plan formulary has different levels or tiers of coverage. You might start out at tier 1, which is all the really basic drugs, generic drugs, antibiotics that are in widespread use that don't cost a lot of money. And generally, tier 1 drugs aren't going to be subject to a deductible, and in many times won't even have a copay or a co-insurance that you have to pay. All the way up to some formularies that have a tier 5, which are your designer drugs, your newer drugs, a lot of the cancer drugs and chemotherapy drugs that you might take from home. Those are generally going to be subject to a deductible and have some sort of co-insurance attached to them. It's important to know that you may pay full price if your drug is not on your plan's formulary and or if you use a non-network pharmacy. So if you're going to be an original Medicare participant, you can purchase a standalone Part D plan from a private insurance company. Note, Medigap pays nothing for out-of-pocket expenses for Part D. Or you could be a Medicare Advantage member, and the vast majority of those plans are going to also include Part D coverage. But note, if you take that funny plan, the Medicare Savings Account plan, you're still going to need to purchase a standalone Part D for that one, because those plans do not roll Part D drugs into those coverages. So next slide, please. What are Part D drug costs? If you're an original Medicare or the MSA, the plans that are available in Pima County range in premium from $750 a month to $140 a month for a standalone plan. HMOs and PPOs under Medicare Advantage, many are included in the Part C plan premium. This is important. There is an additional Part D premium for those same people who pay more for Part B because they make too much money. There is also an additional premium amount that's assessed to you for any Part D plan that you pick up if you're in those income brackets. So again, if you get that letter from the government that says you're having to pay higher premiums because of your income from 2 years ago, Read about your appeal rights, especially if your income has drastically changed from 2 years ago. So then Part D plans are going to have deductibles anywhere from $0 to $480 a year. And note that for some drugs, even in a plan that does have a deductible, some drugs may still not have a deductible applied to them. Once you and the plan have spent $4,400, you will pay no more than 25% of the cost of prescription drugs until you have personally spent $7,050. And at that point, you reach the catastrophic coverage level where you'll pay no more than 5% of your costs for drugs for the rest of the year. And these tally amounts reset every January 1. Part D does not have out-of-pocket limits. Next slide, please. So how the heck do I pick a Part D plan when there's a whole bunch of different ones? They all have different deductibles, different co-insurances, different drug lists. For that matter, how do I pick a Medicare Advantage plan that has different ways that they cover all of the same benefits? Enter Plan Finder at medicare.gov, or if you have signed up for a personal mymedicare.gov account, you can log into your personal account or just log into medicare.gov and locate the Plan Finder. This is a really great online tool that helps you compare all the different Medicare Advantage plans or all the different Part D drug plans that are available to you in Pima County. It lets you load in all of your drug information that you're currently taking. It lets you pick 5 different pharmacies, including mail order, to compare the cost so that you know exactly what your out-of-pocket costs are going to be for any given Medicare Advantage plan or standalone drug plan. And it's got this really great sort function where you can sort it by lowest out-of-pocket cost all the way to maximum out-of-pocket costs. And when I say out-of-pocket costs, I mean the deductible, any premium, and co-insurance. So you can sort them so you can see what is absolutely the cheapest plan for you to pick based on your drugs that you're currently taking. It will also tell you individually how each drug is covered, because your question isn't how is my drug covered under this insurance plan? The question is, how is my drug covered under the insurance plan? It may be covered, but your out-of-pocket costs for that drug may be so expensive when another plan might do it better for you. This Plan Finder is going to give you all of that information. It's available to you on medicare.gov. We do encourage people to sign up for a mymedicare.gov account, which you can do at that same site, because then once you've loaded your drug information into mymedicare.gov, it will save it. So you don't have to load it in every year when you're looking at drug plans, because we are going to recommend that you shop your drug plan every single year. This is also something, if you're not comfortable doing using an internet tool to compare your coverage, that our volunteers on the phone lines at PCOA can help you with. You give them a call, you give them the list of your drugs, they plug everything in for you, and we can give you the output and help you interpret that as well. Next slide, please. More tips for saving money on drugs. Mail order is sometimes, but not always, less expensive. Costs are going to be lowest if you use the plan's preferred pharmacies. You should compare the cash price with your Part D copay. So there's sites out there, GoodRx being the most common one, I think. I've never used needymeds.org, but GoodRx, you can plug in the name of your drugs and your dosages, and they spit out coupons. And those coupons may get you that drug more cheaply than if you use your Medicare coverage and pay your Part D copay. So it's a good exercise to go through. If your medication is in one of those higher tiers, 3, 4, or 5, and it's a copay that you really have a hard time paying, you can ask your plan and have your doctor help advocate for you to give you a tiering exception. You can also ask your doctor about samples, but know that your doctor can't provide you samples for the rest of your life. Also, if your medication's not on the plan's formulary, but you and your doctor have determined this is the only med that works for you, again, enlist your doctor's help and ask your plan for an exception to their rules. And then again, it's very important, each open enrollment, and we're coming up to the end of open enrollment here on December 7th, I believe. It's important to compare plan coverages for your drugs. The reason for this is your drugs change over the year. You might have a new drug that you weren't taking when you priced your plan last year. Insurance companies and their deals with the drug manufacturers and the pharmacies change throughout the year. So you might be paying more for the drug now than you were at the beginning of the year, and there might be better deals out there for you. We encourage you to use Plan Finder or get some help to use Plan Finder to shop your drug coverage, whether you're on original Medicare or a Medicare Advantage plan, to shop that every year to see if there are some savings there. Next slide, please. Okay. There is extra help available for those people who are of sufficiently lower income levels where they can get some pretty strong benefits to help them with their out-of-pocket costs. Let's go to the next slide. These are 3 programs that are administered through the state's Medicaid office or access office. The Qualified Medicare Beneficiary, or QMBE, as we like to call it, is the most powerful combination of benefits. These are for people who are of very low income, who qualify then both for Medicare and for access. You see those income limits, they are very low. But if you qualify for QMBE, it's going to pay your Part B deductible, it's going to pay your Part D deductible, it's going to reduce the cost of all of your drug coverage. So basically, you're going to have Medicare and you're going to have an access plan that's going to pay your out-of-pocket costs for you. Very powerful combination of benefits there. Then there are some additional programs, SlimB or QI1. You see the income limits there for single and married people. These pay your Part B premium for you, and they reduce your Part D copayments. They're basically the same program funded by 2 different organizations, and they have different income limits. If you or you know someone who might qualify within these income limits, pick up the phone, call PCOA. We can help you with these applications. You apply for these through the access office here in Arizona. Next slide, please. If you don't qualify for any of those, there is a federal benefit called Limited Income Subsidy, or LIS, that will lower your Part D premium, deductible, and copays. And again, it's a federal program. Call PCOA again for help to apply for this. Next, this also has resource limits in addition to income limits. By resources, that means money in an account, that's sitting in an account. I don't believe it includes your house, but if you have assets elsewhere that could be converted into cash, it's going to go against those resource limits. Next slide, please. And this, I believe, is my last slide. It's called Arizona Long-Term Care System, or ALTEX. We really very much love our acronyms in this Medicare world. This actually has nothing to do with Medicare, but it's another low-income program that is available for people who require long-term care in assisted living facilities, nursing homes, and provides in-home care for individuals who'd otherwise be institutionalized. This is a program for people who qualify both medically and from an income perspective. There's a very complex income and asset limited application process to go through. We want you to be aware of this benefit. PCOA offers a class on ALTEX. So if you or you know someone who might need this long-term care that is of limited assets and income that might qualify for ALTEX, we urge you to give us a call and get signed up for the next ALTEX seminar so you understand how that program works as well. And I believe, next slide, this will be our pause slide. Yep. Thank you for listening. We will be here at the end of Vicki's session for questions. So stay tuned, and Vicki will be joining us in a minute for the second half of the presentation. Bye-bye.
At this point, we're going to take a 5-minute break. I have 1:53 on my clock, so we'll be back at 1:58 or in 5 minutes. All right, I have 1:58 on the dot. We're going to go ahead and get started with the second half of the program. So Vicki,
Yep.
please take it away.
Okay, next slide, please. Okay, so coming back to where Eileen left off, the decision for people when they're new to Medicare can be a bit overwhelming. So some of the things that are going to matter to different people. One thing has to do with access to providers. How does someone feel about seeing providers, of having to get a referral from a primary care doctor as you would in an HMO? For some people, that's not a big deal. Maybe they've been used to it with their health insurance over the years while they've been working. Other people, that really burns them a little bit, and they really want to see providers without having to go to a primary care doctor, which would suggest that having original Medicare with a Medigap may work better for them. Connected to that is the issue about provider choice. Is it enough that each Advantage plan has to have a certain number of doctors in every specialty? Or again, are you someone who, if something comes up with your health, wants to ask friends and find the very best doctor for a given condition? The more you want to absolutely control who you see, lends people going the direction towards original Medicare with a Medigap that can sometimes bump up against what people can afford. Connected to provider choice is about seeing specialists outside of Pima County. As Eileen pointed out, the Medicare Advantage plans, for those that are HMOs, they are not going to pay for anyone to see someone outside of their network. The Ppos you can, but you can't always get access to them. So that's an issue for people, is access to providers outside of Pima County. What about providers who don't take assignment? Whereas if you're in an Advantage plan, all of their doctors are taking assignment. It doesn't even come up as an issue because they are in the network. And another issue about provider choice is the extent to which you are planning to travel. I talk to some people who say, I never leave Pima County, or I only go and visit my family once a year. Other people really are hoping after age 65 to be on the road a lot. The more you are going to be away from Pima County, the less an Advantage plan will work for you. Also connected has to do with your health concerns. One way to think about the difference between original Medicare with a Medigap and an Advantage plan, and we're kind of pushing drugs over to the side as I talk about this, but if I have original Medicare and Medigap, I'm paying a set premium every month, regardless of how many doctors I see. Versus if I'm in an Advantage plan, I am paying when I use services. And again, different people respond to that differently. Some people really prefer paying that monthly premium and then not having to worry, so that if they think they need to see a specialist, they just call and make that appointment. Whereas other people would really only rather pay when they use the services. So it's something to think about in terms of what you are comfortable with. Please note, if you are under 65 here in Arizona and getting Medicare because of disability or Social Security disability, you cannot get a Medigap until you are 65. So an Advantage plan or original Medicare without a Medigap are your only options until you turn 65. And then when we talk about the cost of medications, that is not specifically original Medicare versus Advantage plan, but of seeing the different choices with the drug plans and with the Advantage plans. And while those extra benefits that they put onto Advantage plans are wonderful, and I think it's great for people to be able to get their eyes checked or their hearing checked or dental, sometimes, depending on whether someone has a lot of health issues, what it may not save you anything, and you might be making a choice based on those extras. So I encourage people to think more about their total medical situation rather than just those extra benefits. Next slide, please. Oh, this is again, we're reminding you to volunteer. Next slide, please. Oh, we're back. Are we back at the beginning, or let's see, keep going. Oh, somehow we got all the way back. All right, Tina will get us where we need to go. Okay, keep it going. All right, here we are. So this just lays out the choices in other ways. Some people are going to choose original Medicare, a Medigap, and a standalone Part D. Some people may choose that Medicare Advantage, Medicare savings account with a standalone Part D. Some people will choose an Advantage plan that includes the Part D. Some people may be eligible for retirement benefits. Again, nearly all of them are going to require that you take Medicare, and they would just be how you supplement it and how that supplement is designed. And some people may be eligible for access, so they would be what we call dual eligible and have Medicare as well as access. And the line at the bottom, you might know this one from TV commercials. You may not be getting all the Medicare benefits you're entitled to. They are generally advertising Advantage plans, or they are actually advertising clearinghouses that will lead to Advantage plans. And while those are one way to go, they are not the only way. Next slide, please. This chart, which you may want to come back and look at, is our attempt to look at what your costs are. So from the top, almost everybody pays 0 for Part A. Almost everybody will be paying that $170.10 for their Part B, unless their income is higher or significantly lower. But then we start getting into the differences, because if I'm on original Medicare or that MSA plan, to get a Part D plan, I am going to have to be paying for it. Again, another plug for that plan finder to get the one that's most cost effective. Whereas if I go with one of the Advantage plans that's an HMO or a PPO, generally there's no additional premium for the drug plan, though with all those options, there will be those copays. And then what you can see is that if I get a Medigap, I am going to be paying a certain monthly premium for that, whereas the MSA and the Advantage plans, most of them do not charge anything, though some of the Advantage plans do. Now, remember, back to original Medicare, while there is no out-of-pocket limit, that Medigap or whatever kind of supplement I have will put a limit on how much I have to pay. With the MSA, they are going to give me some money that would cover me towards the deductible, but would not cover all of the deductible. And with HMOs, if it's in-network, I have copays. Well, for in-network, I pay certain copays, and out of network, those will be more. With original Medicare, any Medicare provider who accepts Medicare and is accepting new patients, I can see. With the MSA, any participating provider who is accepting new patients. And with HMOs, I'm going to have to stay in my network. Now, again, with the PPOs, while I can go out of the network, I do not always have a guarantee that that doctor will see me. And again, higher premiums if my income is higher, and those non-participating providers don't have to accept Advantage plan members. Next slide. If I am looking at Advantage plans, there are some other things I want to really consider. I want to look at the network, and you can generally get information about this from the Advantage plan, and often on their online site, you could get access to their networks and see what doctors are in it. One thing I also suggest as an easier thing to do is, if you know there are some of your doctors who you really want to stay with when you're on Medicare, call to the office manager or the business manager at their office and ask, which Advantage plans does the doctor participate in? You want to be sure if you're looking at an HMO or a PPO that your prescriptions are in the formulary. You also want to know, what do you do if you travel outside the plan service area? I do want to mention that at least one of the larger Advantage plans does contract with providers in outside areas. And there may be some ways to get some services, and we could tell you more about that in the question period. And what about if you're just traveling in a different plan, what's considered an emergency? Those are things to know. You want to also know what those extras that they throw in are, and are there any other costs that you need to consider, and how much will your prescriptions cost on a given plan. They are all rated through CMS, and you can see it's on a 5-point scale, and that can help you determine whether you want to use that plan. And do remember, and I'll swing around to talking about this again, but when you make a choice for an Advantage plan, you are making that choice for the year. And then at the open enrollment period, you could switch for the following year. Next slide, please. There are also here in Pima County a few special Advantage plans. Some of them are for people with chronic health needs or people who live in certain institutional care. There's one for people with COPD, one for diabetes, heart care, end-stage renal disease, 2 that are working in nursing homes or certain kinds of institutional care. Now, just because there is an Advantage plan for people who have diabetes does not mean that if you have diabetes, you have to use those plans. It may mean that they offer some specials or special extras that may be beneficial, so it may be worth looking into. Eileen also spoke about the people who are dual eligible, who have Medicare and Access. And there are 3 plans, Advantage plans for people who are dual eligible. And again, while someone who is dual eligible does not have to join one of those plans, in this situation, they may want to, because then they know that all their doctors and providers are both in that Advantage plan and also in their Access plan. Next slide, please. Okay, so now we're going to start talking about how you actually enroll in Medicare. And what you can see below our alarm clock here is you can see some things about Social Security and their website and their national number and their local number. And that is because the initial enrollment in Medicare is done through Social Security, though if someone has retired from the railroad, they do it through the Railroad Board. Next slide, please. As we like to say, everything starts with A and B. You have to have that original Medicare to get some of the other benefits. Next slide, please. So here's something important. Some people will be automatically enrolled in parts A and B, though as we say in purple, that's not the end of the story. But the people who are automatically enrolled are those who are receiving Social Security or Railroad Retirement Board benefits for at least 4 months before their 65th birthday, and those who are now hitting their 25th month of their disability benefit. What happens for those folks is the Medicare card comes in the mail. Real important to check that Social Security has your correct address, because you do not want your Medicare card going where you lived a year or 2 ago. It is important to note that just because you are automatically enrolled in parts A and B does not, you still have the opportunity to delay part B, and we'll be talking more about that. And then, as we say, because automatic enrollment is not the end of the story, you do have 3 months from that Medicare effective date to sign up for an Advantage plan or a prescription drug plan. Next slide, please. Now, many people are not taking Social Security before they are eligible for Medicare. And they do need Medicare at age 65. So they get an initial enrollment period, and that is an enrollment period of 7 months to apply with Social Security or the Railroad Retirement Board. So if I did everything on time, the month I turned 65, on the first day of that month is when Medicare would start. So I would be able to enroll in the 3 months before that, and I would also have the 3 months after that to enroll. But here's something important to note. If I do that in the 3 months before, particularly the 3rd month before my birthday month, I'm going to get that Medicare card in the mail, and it will have my effective date of the first day of the month of my birthday month. But if I wait and waited till 3 months, the 3rd month after I turned 65, while I am still eligible to apply in that time, they may delay sending me my Medicare card, and my Part B may be delayed up to 3 months after the date I signed up. So you want to be sure about how that's going to work for you. And again, the time frame for signing up for an Advantage plan or a drug plan is this same 7-month initial enrollment period. Next slide, please. Now, for some reason, Medicare has decided that if your birthday is on the 1st of the month, you actually have the 4 months before your birthday month and only 2 months after, and your Medicare would start the first day of the prior month to your birthday. Just something worth knowing, and if you're affected by that with a birthday on the 1st of the month, be aware of that. Okay, next slide. So let's talk then about how you enroll in Advantage plans and drug plans. Next slide, please. To enroll in an Advantage plan or a drug plan, you can call Medicare. You can use that plan finder, and if you've found the drug plan or the Advantage plan, you can start the process of enrolling right there. You can contact the plan directly, or you can use an agent broker. They will not charge you. They are compensated through the plans. We have spreadsheets of all the Advantage plans and all the drug plans that are available here in Pima County. To enroll in an Advantage plan, you must be enrolled in Parts A and B. To enroll in a standalone drug plan, you need only be enrolled in Part A or Part B or both. And while we say first enrolled in, most times people are taking care of all of this somewhat simultaneously. Next slide, please. Okay, the signing up for a Medigap is a little bit different. Next slide, please. To enroll in a Medigap, you can contact the plan directly or through an agent or a broker. We do also have spreadsheets of all the Medigaps that are available here in Pima County. To enroll in a Medigap, you must have original Medicare, both Parts A and B. You may buy a Medigap anytime an insurer is willing to sell you one. However, you cannot get a Medigap if you are on access or if you are under 65. And something I spoke about, but it is so important, I will talk about it again. When you are first enrolling in Medicare, you have a guaranteed issue, meaning if you are interested in getting a Medigap and you apply within that 6 months of that Part B start date, and again, you could do this all in advance and have it start at the same date, or on your 65th birthday, if you've already been receiving Medicare due to a disability, they cannot turn you down. They cannot charge you a higher premium. They cannot even ask about prior health. So what I would say here is if you are someone who has had something really major in a health condition and you are interested in a Medigap, you may really want to get it during this guaranteed issue, because you might be someone where they would not take you if it wasn't a guaranteed issue period. And again, if any of you are affected by that or think you might be, please ask us more about that, either when we do questions at the end or by calling us directly. Next slide, please. We bring this up. Do you have retiree health benefits? And the reason we bring this up is if you don't take those retiree health benefits when they're first offered, or if you disenroll from retiree health benefits, some plans may let you keep a foot in the door and get back in. Some plans you can never get your benefits back if you don't take them. You also want to know if you are affecting any family members to lose coverage. So what we say is before you enroll in an Advantage plan or a drug plan or a Medigap plan, you want to really know what retiree benefits you may be eligible for so that you are not getting rid of something that may have been beneficial. There are so many different kinds of retiree health benefits that we cannot say anything globally about how good or better any of them are. Some are great and give you some really good benefits. And, I have seen someone who retired from a municipality outside of Arizona, and her benefits, they were going to reimburse her for her Medigap. So she really wouldn't want to turn that down. So you want to understand what retiree benefits you have before you enroll in something else. Next slide, please. Okay, so delaying Medicare. What if you're not ready to take those benefits, and why might you not be ready? Next slide, please. Okay, so first we're going to talk about premium-free Part A. Those people who have 40 or more credits, that is undoubtedly most of you. Here's what's important to know. If you are eligible for free Part A, you may enroll with no penalty anytime during or after your initial enrollment period. So even if you did nothing at 65, at 66, you could get that premium-free Part A, no penalty for doing it late. Here's something though that's important to know. If you are over 65, when you apply for that Part A, your coverage date will be retroactive up to 6 months from when you sign up, but no earlier than your 65th birthday. Now, for most people, that would have no impact. But if you delayed taking Part A because you were working somewhere where you had a health savings account, you want to be real careful about that retroactive coverage date, because they do not allow people who are enrolled in Medicare to be contributing to HSAs. One of the largest groups that have an HSA here in Pima County are people who work for the county, and their HR people can take money back out of the HSA for you if this is going to be an issue. And again, if you have questions, let us know. Next slide. Now, those people who would have a premium on Part A would often not want to delay because it is so costly for them. And the penalty would put it another 10% of that Part A premium. For twice the number of years, you could have had Part A but didn't sign up. I will say, if someone is not entitled to premium-free Part A because they are very low income, there may be ways for them to get the equivalent benefits of Part A without actually being enrolled in it. And again, those folks should talk to us. Next slide, please. Now, many people might delay Part B, and I'll explain why. That penalty would be an additional 10% of the Part B premium for each 12 months that you could have had Part B and did not enroll, and it lasts as long as you have Part B. But here's the really, really important thing. If you have coverage through you or your spouse's current job, and that employer group has at least 20 people, there will be no penalty. If you follow what I'm going to talk about next. If you are disabled, you could delay that Part B if you have coverage through you or family's current work and the employer group is at least 100 people. But we're talking about current employer-based health insurance. not VA, not Cobra, not retiree health benefits, not marketplace. Those things do not exempt you from the penalty. But the other thing is, if I have delayed Part B because I have because I still have coverage through my work or my spouse's work, I do need to enroll during my special enrollment period, which is within 8 months of that loss of coverage. And there are some very specific forms that we could give you or Social Security could give you, and they would be for, mostly to show that you had insurance all along. Now, while you technically get these 8 months after the loss of the coverage, you only have 2 months to enroll in a Part D or an Advantage plan as part of that special enrollment period. Next slide, please. If you missed all of those things, there is a general enrollment period, and that is for Part B and Premium Part A, and that is each year, January 1st through March 31st. You have until June 30th to enroll in a Part D or an Advantage plan, and the coverage does not start till July 1st. And if you would be subject to enrollment penalties, they will apply even if you are enrolling during this general enrollment period. Next slide, please. So the marketplace, which is also called ACA, which is also called Obamacare, probably there are other names for it. The expectation is that marketplace participants will transfer to Medicare when they first become eligible. And the reason for that is that the subsidies that you are getting end if you are eligible for premium-free Part A, whether you sign up or not. Now, for the people who would pay a premium for Part A, they might be able to stay on their marketplace plan. And again, you may pay a penalty for Part A and or B if you enroll later than your initial enrollment eligibility date. Those marketplace plans are not automatically canceled. So once you are close to starting Medicare, and by close, I mean in that last month before Medicare becomes effective, you would want to notify the plan of your switch to Medicare, and you'd want to make sure you had taken care of family members who might be on a plan with you. Next slide, please. Cobra. Some of you may be familiar with Cobra as insurance that you got when you left a particular job. Delaying Part B because you have Cobra does not exempt you from the Part B late enrollment penalty. Cobra is not technically a supplement. There is some things if you have Medicare when you become eligible for Cobra, you might use both, but it really has only to do with end-stage renal disease. And you would probably want to check with your Cobra administrator. And if there are any issues, remember that you want to avoid that late enrollment penalty for Part B. Next slide, please. Now, people sometimes also delay Part D, the drug coverage. Well, let me say this, the penalty would be an additional 1% of the current base beneficiary premium, which is currently $33.37 per month for any continuous period of 63 days or more after your initial enrollment period for as long as you have Part D. That's the penalty. Now, if I didn't sign up for a Part D when I turned 65 because I was traveling the world and didn't feel I needed Part D, I would have that penalty when I signed up. But I would not have a penalty if I had what is called creditable coverage. And that is through certain group health insurance, either through an employer or as a retiree. The VA is creditable coverage. Some of you may be familiar with getting a notice from your health insurance company saying whether your plan, your drug coverage is creditable or not creditable. And if it is creditable, you can wait and take Part D later or stay with that coverage. But if it is not creditable, you would want to take the Part D so that you would not have that penalty. And you'd also then know that you're getting your drugs covered. Next slide, please. Okay, so now you're enrolled. What do you do to make changes? And in general, these are for changing, not enrolling. Next slide, please. So every year, we're in it right now, October 15th through December 7th is the annual open enrollment period, with the changes becoming effective January 1st. Easy to change Advantage plans, easy to change or add a standalone drug plan. And you can also switch between original Medicare and your Advantage plans. Then come January 1st through March 31st is what's called a Medicare Advantage open enrollment. And this applies only if you are already enrolled in an Advantage plan as of that January 1st. You can still switch Advantage plans, or you could leave your Advantage plan to go back to original Medicare and get a standalone Part D. If you're going back to original Medicare, you may want to have already looked into whether you're going to be able to get a Medigap, because you might be subject to that underwriting, which means they could turn you down. Next slide, please. There are also some special enrollment periods when you can change your health or drug coverage if you move from your plan's coverage area. So let's say I'm in an Advantage plan here in Tucson and I move up to Phoenix. I have the right to make some changes because I no longer live where I am covered. If I have moved into or out of assisted living or skilled nursing, if I have a chronic condition that is covered by a special needs plan, if my retiree plan is ending, if any kind of plan is discontinued, or if there is a 5-star plan and I want to enroll in it. There is one here in Pima County, and we could ask Tina more about that, but I could then make a change at other times if I wanted to enroll in it. Next slide, please. For those folks who are lower income, those who are on access, who are in any of those Medicare savings programs, or who are getting the extra help, they are allowed to make changes once per calendar quarter during the first 9 months of the year, and then use the open enrollment period as well to make changes. Next slide, please. So if I want to change Advantage plans, I just enroll in a different Advantage plan. If I want to change or add a standalone drug plan, I just enroll in it. To leave original Medicare for an Advantage plan, I just enroll in the Advantage plan. To leave an Advantage plan for original Medicare, if I enroll in a standalone drug plan, or I call Medicare, or I file a letter. That's what I would need to do. Next slide, please. Now, just be aware, things that happen automatically. If I enroll in a standalone drug plan, that will disenroll me from an Advantage plan if I have been enrolled in it. If I enroll in an Advantage plan, that will disenroll me from original Medicare and my standalone drug plan, with the only exception being that Medicare Advantage MSA plan. Next slide. So people often ask about switching Medigap policies. And one thing is that if I have a guaranteed right, if I am in a guaranteed right period, I can't be denied or charged a higher premium, so I can make a switch. And that would be if I did that during my initial 6-month Medigap guaranteed enrollment period. Now, again, I could purchase, I would have a guaranteed issue for a Medigap plan A, B, K, or L if I left my Advantage plan or area, or my Advantage plan or Medigap was discontinued, or an employer retiree plan was discontinued. So many people get a Medigap and they stay with that same Medigap policy for the rest of their life because they know that if an insurance company could turn them down, they would. But you're always welcome to apply for one. The insurance companies will welcome that, but you may be subject to health questions and you may have to pay more depending on your age. Next slide, please. There are also 2 other Medigap guarantee rights. So let's say I join an Advantage plan when I was first eligible for Medicare at age 65. I have that first year to try it out. During that first year, if I don't like it, I could switch to original Medicare, and I do have the guaranteed right to buy any Medigap. Or let's say I started with original Medicare and a Medigap, and then 1 year decided to switch to an Advantage plan. I have that 1 year to try it out, but my only guarantee is to get my former Medigap plan back. Next slide, please. So paying for premiums. Now, if for your Part B, that Part B premium, if you are receiving Social Security or Railroad Retirement Board money, they will make those automatic deductions from your retirement payments. But as you know, many people start Medicare before they start getting Social Security. So what happens then is that Medicare will bill you. And they generally bill you quarterly. You can set up to pay with credit card, with a bank check, with a draft, with an automatic payment. You do get a monthly bill if you have to pay that IRMA, that higher one, and you can set it up to do an easy pay automatic deduction. For the Medigaps, for the Advantage plans, and the drug plans, you can set that up to come out of your Social Security. You can authorize automatic deductions, or you can let them bill you and you pay monthly. They will tell you, particularly the drug plans, how they want to be paid. Next slide, please. Okay, we're going to talk about a few other things. This is one many of you may have heard about: observation stay. Can you spot the difference between inpatient admission and an observation stay? It does not look very different. Next slide, please. So this comes about with people who have started in the emergency room. And many times, rather than being admitted as a patient, they are put on observation status. So the difference is, if I am admitted to the hospital, that is Part A. And then I have that big deductible, but if I have a Medigap, it is going to pay that for me. And I would have no other cost at that hospital under Part A. Whereas if I'm on observation status, everything is somewhat going through Part B. The other things which can happen are that if I was admitted to the hospital, I might meet that qualifying hospital stay for skilled nursing afterwards. Whereas if I'm on observation, I am not eligible for that skilled nursing. The other problem is if I am admitted to the hospital, they would be able to give me medications that I take on a regular basis that I might not have had with me. Whereas if I'm on observation status, I may need to get those medications from the hospital pharmacy. I could then try and get reimbursed through my drug plan. You can't make them admit you if you're on observation status, but it's important to know what your status is. At the bottom, we also have a note that doesn't have to do with observation, but if you have been admitted to the hospital and you feel you're being discharged too soon medically, you can appeal before leaving the hospital. And all of the discharge staff know about Levanta, is the agency that handles these kinds of appeals. It can't be just because you're waiting for your sister to fly in to take care of you. But if you felt you were not medically ready, you can appeal that decision. Next slide, please. If you are on observation status after 24 hours, they are expected to give you this Medicare Outpatient Observation Notice, or what we call MOON, and it will tell you the reason that you are not an inpatient and what it is likely to, how it is going to affect the costs of things. Next slide, please. This is also something that comes up for people on original Medicare with Part B, not Part A. So with observation in a doctor's office, in a lab, or with a durable medical supplier. And this is called the Advanced Beneficiary Notice, ABN. So if you are asked to sign this, it is telling you that Medicare may not pay for a particular service or a supply, and what that likely cost would be if Medicare doesn't cover it. You have three options. Option one says, do it. I want Medicare billed, but and I understand that if Medicare doesn't pay, I can appeal, even knowing that I may not win that appeal. I'm going to skip to option 3, says don't do it. I'm going to call Medicare, or I'm going to call my doctor. I'm going to find out more before I do this. Option 2 says do it, but don't bill Medicare. And the only reason, and I don't really have a good example of this, but the only reason I could imagine someone doing that, and maybe let's say in a lab, maybe they say for a particular lab test, Medicare doesn't usually pay for it, but they're only going to charge you $5 for it. And maybe that would be okay with you to do it that way. But you can always get more information, and you can always call your doctor about it if that would seem helpful. Next slide, please. Tina, are you taking over, or am I doing this?
I can go ahead and take over to give you a little bit of a breather if you want.
Yes, I'm going to go get a little water. Okay.
Okay. I'm going to just go over very quickly. I know everybody's been very patient. This has been a long presentation with a lot of information. When we have any kind of open enrollment, or it seems like it's getting to the point to where year round, we are getting inundated with scams. A lot of times scams can be something as simple and in your face as advertisements on social media. They don't just have to do with Medicare anymore, but there's scams out there for everything. I want to go over a few just very briefly with you. And I lost control of my slides. There we go. One of the scams that has been continuously going on throughout the years has been durable medical equipment. And examples of these things are just a few: oxygen, knee, leg, arm, back, neck braces, therapeutic shoes. The list here is all of the different types of durable medical equipment that you have to have a prescription from your doctor. You have to have a doctor's order. Where the questionable tactics come into play is when they advertise these things online. There could be advertisements, and I'll go into that in a couple of slides, about a back brace that was advertised on commercials several years ago. But one thing I want to cover real quick is the newest scam that came about in 2021 is the offering of a plastic Medicare card. Any of you that have received your Medicare card, you know that it's paper. There was a scam that started this year saying that, hey, callers are calling saying, if you give me your information and your Medicare number, I will order you a plastic Medicare card with the strip on the back and the chip in it. Medicare is not issuing new cards. We've been asked to really educate people on this. There are no plastic cards coming out at this time. I don't remember if it was either Vicki or Eileen mentioned the clearinghouses. There are many clearinghouses out there that call to try and get people's information. And yes, they give this information to agents and brokers. Agents and brokers have rules that they have to follow on how they approach or can approach beneficiaries for Medicare. The clearinghouses, however, go outside those bounds a little bit. They do the cold calling to beneficiaries. They'll call and they'll say, are you getting all the benefits that you feel that you deserve? Do you need medical or dental or vision care? So what they'll do is they'll talk to you and they'll say, well, I can set you up with a plan. This is just an example that I'm giving of a couple of cases that we had. What we're trying to do here again is to educate. We're not saying that any of the brokerages or agents are bad. We're just trying to help educate and tell you to please, please, please be very, very savvy in answering any questions that anybody cold calls you with. Our best recommendation is if somebody cold calls you from any type of clearinghouse saying that they represent an agency or a brokerage firm, hang up or get their names and let us know, because more often than not, they are not following the rules and they are trying to get people into plans that might not necessarily be at your best interest. So please beware of these. And if Anybody calls you and attempts to change your plan, please call us, let us know. The numbers will be at the end of the presentation. This is a card that one of my counterparts got in the mail. And this was another clearinghouse trying to get someone to buy into a plan. What you can see circled here is it says this is not an official notice from a Medicare or any other government agency. This is the first red light or light bulb that should go on to say, hey, maybe I should be very careful about this. So right here is a list of what agents and brokers can and cannot do when it comes to approaching Medicare beneficiaries. Say if we were having this presentation in person, we can't stop agents or brokerage representatives from attending the presentations. But if they do, they are not allowed to approach any of the beneficiaries that are part of the presentation to try and encourage them to talk to them about enrolling in any of their plans. That's a big no-no. They also cannot offer gifts or offer groceries. This is the advertisement that Vicki so tirelessly went into looking at the fine print. And the fine print is another thing that I encourage people to look at. This was a back brace ad that came on TV during open enrollment several years ago. There's many other examples. But on this, they're asking, do you have back pain? Well, if you call us at this number, they have a doctor that will write a prescription for Medicare, but that doctor doesn't know you. So what happens is you may get a back brace that's not going to work for you, but you can't get another one for 5 years because your Medicare number has been used for this piece of durable medical equipment. So we caution everybody to not call and buy into any of these kinds of advertisements, or again, be very, very careful. There's another plan that's going on right now about Medicare and diabetes. They're saying there's, I apologize, this is a fine print thing. That was one of the reasons I wanted to bring this up. Stop by for your complimentary, no obligation health plan comparison. And then you're going to get a free auto shade or a fleece blanket or a tote bag. A lot of plans really aren't supposed to be doing this, but it's considered hard sales. So if they get you to come to them, they're not really breaking the rules. They're just bending them a little bit. What we're asking you to do is to be very, very careful again with this, because they are not, they're not letting you know what the fine print says. Callers are going to be directed to a licensed insurance agent. So they sound like they're going to give you some advice on different plans, but what they're doing is they're steering people into one particular plan. That's a little bit, that's not necessarily bad, but they may not necessarily have all of your best interest in mind. That's where we're trying to educate everybody on this. The best route to go is a place that is unbiased. We have more access here at PCOA, for example, on all of the different plans and what they offered. And again, we're not selling anything, but we're laying it all out for you so that way you can make the best decision that is the best for you. So this was the other part of the back pain advertisement. I apologize, my slides got a little out of whack. But here was something to be noted too, is when you call into some of these advertising commercials for durable medical equipment or anything, if you're on the National Do Not Call registry, you will automatically be knocked off of that registry and you're going to start getting a lot more calls. I had a question this morning that somebody said, how can I get these calls to stop? Well, one, don't answer them. And if a lot of these agencies, or not agencies, but a lot of these scammers, particularly, if they get somebody or if they get a hang up, they know that there's a live person there, they'll keep calling. And like some of these advertisements here, you call in, you ask for just information, count on the fact that you're going to get a lot more calls. So be very, very careful and very picky about who you answer the call for or from. Before you reply to an ad, remember you have to have an approved supplier. You must have a doctor's note. And is the TV ad the best solution for you? Or would it be better for your doctor who knows your medical problem prescribe the brace for you? Medicare will pay for a basic model. Upgraded models require justifications. Suppliers who don't take assignment have no limit to the amount that they can charge. Another thing to be careful of, Medicare only pays up to the assigned amount. A copay is usually required unless you have access or a supplement. Another thing that we like to educate people on too is your Medicare Summary notice that you get every quarter, whether it be electronically or in the mail. Do you recognize the names of the doctors and providers on that? Do the dates match your appointment dates? Did you get the services listed? Do the services match the services on your bills and your receipts? Check the maximum you were billed. Were you billed the right amount? If something looks fishy, more than likely it is. So we encourage you to please contact us at the numbers below, and we can help you sort through these. So we want you to also watch out for fraud and to watch out for scams. They're getting very, very crafty. They're getting very good at sounding like they're legitimate. This slide here shows you how much Medicare is fraudulently billed every year, 60+ billion a year. You can help reduce that cost by being aware. It's that simple. This is benefits that is being taken away from you and your family members because Medicare is being defrauded every year. So protect your Medicare numbers, your personal information. Medicare will never ask for a fee for your personal information. Beware of free services that ask for your Medicare ID. Check your medical summary notices and explanation of benefits for mistakes or services you did not receive. We actually did help a lady this year who was charged for things that she did not receive. So we were able to help with that, and she did not have to pay the cost because she did not receive these services. So anything like that comes up, please call us at PCOA. Our number is right here, and I will put them up again on the slides for you. I'm going to brag just a little bit. This is the way I see the Medicare team. All of the volunteers and staff counselors, they're superheroes. They're there, they're dedicated. Our volunteers are very dedicated, very knowledgeable. It's almost like they have a passion for talking Medicare. So if you need any help, please give us a call or email us at these numbers. The top number is for all Medicare information, open enrollment. The second number is the Senior Medicare Patrol, and that's where we help with scams or possible fraud or even billing issues. So the motto for 2021 has been slam the scam before it slams you. Again, help is available. We're here. These are our numbers. I know I've been giving them to you a lot, but I want to make sure that you see them. So if you have any kind of questions, appeals, comparisons, fraud, or programs for lower income, or even questions about the higher income rates and helping with appealing those, please let us know. We are here to help you. Last thing is this is my name and my email address. So if you would like the slide deck for this presentation or any of the other spreadsheets that we talked about within the presentation here, please shoot me an email. It takes me 24 to 48 hours to get that stuff out to you, but just say, hey, Tina, can you give me all of the stuff that you talked about in the presentation? I'd be happy to get it to you. And with that, I'm going to open it up for questions. And I see a couple here in chat. So Vicki, have I lost you? Are you still here?
No, I'm here. I'm here.
Okay. The first question that came up, and I did reply in chat, but it was just directly to the person that asked, is when will the presentation be available online? It takes about 24 hours for me to get the presentation in the cloud, and then I send it on. So I'm looking at the absolute latest to be mid next week when the presentation will be available along with the slide deck. But if you would like the slide deck before then, please shoot me an email. The next one is, what's included on the definition of income?
That's a good question. I mean, in general, what I would say, and Tina, you can help me with this, is if you file a tax form, the amount that shows as income is that. When they look at it, and they being like the state office, well, when they're looking at it for IRMA, they are looking at your taxes from 2 years previous.
Mhm.
For the assistance programs, they also sort of have access to Social Security amounts that people are getting. It is anything that is coming to you as cash that can be, shown in a sense. And if you want anything more clear about that, you try and ask me about it. Yeah.
The next one's, what's the difference between Medigap and Medicare supplements? Those are basically the same thing, or they are the same thing.
They are.
Mhm.
In a sense, the larger category is Medicare supplements, because those can be maybe through a retiree plan, or people who work for the federal government. Some of the FEHB are supplements to Medicare, but the biggest category is the Medigap, because those are ones that, in a sense, anyone can buy. And nowadays, we kind of use the term for supplements as different than Advantage plans, which are kind of a different way of getting those services.
Okay, the next one was, are the slides available to us? Yes, again, shoot me an email. I will get them to you, and they will also be online mid next week. I was told I would get kicked off of UHC Dual Complete when COVID was done. Do you know when this will be?
So yeah, go on, Tina.
I was gonna say, I don't know offhand. Vicki, do you?
Yeah, well, I don't know exactly. I'm the dual complete is for someone who is dual eligible, and it may be that with COVID they just weren't kicking people off. The better people to ask about that. One thing would be the plan itself, UHC dual complete, and try and reach someone in their customer assistance and see what information they could give you. And the other one would be the Arizona Department of Economic Security, because they run the programs, the Medicare savings programs.
Okay, if you guys would like to unmute yourself, we'd be happy to take some questions, some more questions too. Whoops, I'm playing with the slides. Sorry about that.
Can you hear me?
Yes.
I have a question. It's pretty basic. Just turned 65 here a couple months ago. On the 4th of October, Medicare went into effect. A and B went into effect October 1. I'm leaning towards, after your presentation, I'm leaning towards Medicare Original because we travel quite a bit.
Okay.
But not going to do that forever. But we travel all around the United States, and so anyway, I'm going to have to get a Part C and a D here, a Medigap and a drug.
Not the C, not the C. You get the Medigap and the D.
Oh, I thought Medigap was Part C.
No, the Advantage plans are Part C.
Oh, okay, I'll cross that off my list.
I know.
Okay. So I need a Medigap and a D.
Right.
Now, how much time do I have to go ahead and research those and make selections?
Okay, so you said your Medicare started October 1st.
Yeah, 10/1, yes.
So for the drug plan, you'd have this month and next month. So December or January. you technically, let's see, and for the, I'm sorry, for the Medigap, October, November, December, January, February, March, you could go through March, but that does mean you don't have that coverage. They won't
Right.
backdate them. So if you were to do it this month, you could get them all going. The longer you wait, the longer before they will start.
Okay, so a deadline for me is January 1 for D and March 1 for Medigap. I need to get my ducks in a row by then.
Right. And from Tina, again, if you email Tina, she could send you the spreadsheets that we have of all the Medigaps that are for sale in Pima County, as well as a different spreadsheet of all the standalone Part D plans.
Okay, Tina, your email's in my phone. You will be getting an email here after this presentation.
I look forward to it.
Thank you. Thank you. This is very well done. My wife will be on Medicare soon, and so it was helpful to her too. So.
Oh, good, good.
Thank you.
Anybody else? Sometimes it's a little overwhelming when you take in all of this information, because it certainly is a lot and it can really make the head spin. What I do say to people is, if you're not facing any deadlines, although of course the end of open enrollment is coming, give yourself the rest of today not to think about Medicare, and then approach it again tomorrow, and then you can call us and one of the volunteers will call you back if, as you look at it, you know, other questions sort of come up. And I see part of Linda's message, but I don't see enough of it. Let's see.
Oh, in the chat?
Oh,
Okay. Do you want me to go ahead and
oh,
read it?
now I'm seeing it. I'm sorry.
Okay.
Again, it's an issue about financial and money from retirement without losing Social Security. So again, not my area, and I'm not quite sure who at PCOA would fully know about that. The money from a retirement account should not affect Social Security. It could affect where you stand with Medicare and whether you are getting the whether you are on a Medicare savings program. And actually one of ours, if that's what you're asking about, yeah, I'm looking at two things all at once, but if it has to do with the impact of money from a retirement account affecting your status with Medicare savings program, call and speak to one of our volunteers and they could check with our staff person who would know how that works. It should not, as a separate thing, should not have any impact on your Social Security.
We also have the Elder Rights and Benefits program at PCOA. You could call the helpline and see, they do a little bit more work with taxes and Social Security. I don't know if that's something that they could possibly help with. If all else fails, I would call the local Social Security number. And if you want a copy of the slide deck, the number is within the slide deck as well.
And I saw another question, again, from the person with UHC complete, and about whether to do nothing or not. And I am generally of the opinion that it is better to get the information and know what you need to do rather than just waiting, because sometimes if you just wait, all of a sudden you don't have a benefit that you thought you had. Whereas if you are proactive and finding out what's involved, there may be ways of getting that resolved in your favor. And again, please call us and we could try and help you more directly and see. We are able to sometimes talk with people at the Department of Economic Security and at least understand where someone is in this process.
Great questions.
Yeah. Anything else?
In other words, if I think all is well and want to not change anything, can I just let it roll over? Yes, I believe that is the case. If everything is fine for you, then you don't have to do anything during the open enrollment period.
There's a question also about how do I know if I'm on a Medigap or an Advantage plan? And that's a wonderful question. First thing I would say is look at your card. And your card, if it's an Advantage plan, should say on their Medicare Advantage card, Medicare Advantage plan. A Medigap card would say Medigap Plan F or Plan G. The other thing is whether your drug coverage is with that plan or whether you have a separate drug plan. If you have a separate drug plan, then it is I would guess that it is a Medigap. Those are the main ways. The other thing is, are you paying a premium for it? You know, or not. I was going to say something else about how you'd know. It also has to do with whether you are getting, do you get summary notices from Medicare, or are you getting only an explanation of benefit from a plan, which is more likely an Advantage plan? And if you're really stymied by this and not sure, then contact us and we'll see if we can help. I see another question about, are there different open enrollment periods for Native Americans? Not to my knowledge. There is an office in Phoenix with a SHIP program like ours that does that works more with many of the tribes here in Arizona. And at PCOA, we could give you her number to if there would be anything else, but I doubt that there are different enrollment periods. And someone's talking about an online account to compare plans and it doesn't have matching information. I would suggest that you call and one of us may be able to help you better from the office when we could get online and look at things as well. And that's kind of our default answer for many things is call us and let us check on it. You know, there's a whole range of kind of normal things that affect lots of people. And then some people are, you know, more unique and something else is a little bit different. And we'd have to do a little checking to figure out what that might be for them. But that's what we do. And as Tina said, that's what we like to do, us Medicare volunteers.
Well, if we don't have any other questions, I'm going to bring this to a close. So please look on the PCOA website next week for the presentation. And please contact me if you would like any of the information that we talked about. If you have any deeper questions that you would like to really dive into, please give us a call at the numbers that I posted, and we'd be happy to help you. Please understand though too that we're trying to get people with open enrollment questions through first, since we are coming down to the end of that. But we're trying to help everybody out as best we can. The staff and volunteers are staying on top of things. I am amazed with how quickly they're getting back to people and how I'm just amazed with them. They are shining stars, I think. So with that, I'm going to end this and thank you all very, very much for attending with us today.